my name is Cale Evans. I'm an ADN student here at Wilson State College, and this is my video for IV therapy. So, before I get started, I got my healthcare provider orders here in my MAR, and I have new orders to insert an IV catheter and administer 1,000 mils of lactated ringers at 150 mils per hour to a one Shirley Coase, date of birth 4/3/1987. She does have an allergy to codeine, and after looking at these orders, I'm not going to be administering that, so it's good to check that off. Okay, so now that I've got my MAR here, for my orders here, I can go and enter my patient's room and introduce myself. So knock, enter in, introduce myself, perform hand hygiene. So I'm just going to explain the procedure to Shirley. Say, hi Shirley, could I get you to confirm your name and date of birth for me? Okay, Shirley Coase. Okay, 4387K, and then I'm also going to check her armband here. Okay, and that matches my MAR here, and then same with the codeine allergy. Okay, so that all checks out, so I know I have my correct patient. Okay, so I'm just going to tell her about what we're going to be doing today. So, Shirley, I got an order from the doctor today. We're going to be inserting an IV into your arm, and we're going to be giving you 1,000 mils of lactated ringers just to help out with that dehydration. Okay, have any questions? Have you had an IV before? Yeah? Okay. And did it hurt or anything? Did you have any things go wrong with it? No? Okay, good. Well, do you have any other questions for me? No? Okay, good. All right, well, I'm just going to step out, and I'm going to go gather my supplies, and then once I come back in, I'll get that IV in for you, all right? Okay, good. So I left the call button with the patient, and she's sitting comfortably, and I go back to my med room, and this is where I can start my med checks and making sure I have all of my supplies. So for this, I'm going to need my IV. So I'm going to need my 1,000 mils of lactated ringers at 150 mils. So this is my lactated ringers here, 1,000 mils. I'm going to make sure to give the bag a little squeeze, make sure there's no holes, there's no particles, it's not off colored, there's no punctures or anything. That looks good. I will be able to get that. And then I'll also do that for all of my other supplies, just making sure that there's no punctures, they're not open or anything like that, and they're still sealed and sterile. So here I have my primary tubing. Okay, and that's what I'll use to spike the bag. Here I have this. And this is just my saline lock. Okay, and that's sealed. And then I got 2 saline flushes. And then my ChloraPrep starter kit, so this is just going to be used to sterilize before I put the IV in. And here I got my 20 gauge by 1 inch, okay, and my patient's tags here, and this is just one of her labels here, so it is Shirley Coase 4387, so that all matches my MAR here, and so I'll be able to put this on the bag once I open that up, and then I'll just always have some sterile alcohol pads here ready for me. So that confirms my first med check. Once I go back into the room, which I'll do now, I'll bring my supplies in. Okay, so knock on the door again, and then close the door to provide privacy, and then I'll just get my second check with the patient again. So I'm going to ask for her name and date of birth again, and she gives it Shirley Coase 4387, and I'm also going to check the label again for her wristband, and that matches my MAR. And then I'm also going to check this label to make sure it matches too. Okay, and then the allergy also matches too, so allergic to codeine, that matches, and this also matches my MAR. So I know I'm in the right patient's room, and I got all the right supplies. So now that I'm at bedside, I'm going to also do another med check. So I'm just going to make sure I got my 1,000 mils of lactated ringers here. Okay, and then okay, got that. The same flushes. Okay. Alright, so I'm going to perform hand hygiene, make sure I'm ready to go. Is there any other questions that you have for me, Shirley? No? Okay, good. So, before I get started with any of this, I'm just going to make sure to put on another set of gloves, and then I can start hanging my fluids here. So, again, I'm just going to check again, make sure there's no holes in my bag or anything. There's no particles floating in there or anything. Okay, so then I can open it up. It's not been opened, it's not expired or anything. open that up and bring that out. And then I can open up my brand new primary tubing here. Pull that out. And then this is sterile, and so I don't want to touch this to anything else because this is going to be going directly into the patient. So I'm going to pull this tab off and then this one off. Sometimes it can be a little hard to come off. Okay. And then I'm just going to spike the bag. In. All the way. Okay. And we're in. Make sure that this is still closed because I don't want it just running just yet. Okay. And then I can go ahead and hang this up here. Perfect. Now I can go ahead and label this bag that it is my patient's on the back side, not to cover up any of the information on this bag. Plus that. Garbage here. So now I can take off all these extra papers and start unrolling all of this. Okay, so now what I'm going to do is I'm going to prime my tubing here. So I'm just going to open this up, make sure it's upside down. Make sure that's open, and I'm just going to squeeze this till about 2 or 3 times so it's about halfway full. Okay. I'm just going to make sure that this is inverted. Wait for this fluid to come down. And I'll pull this tube off. And that's going to stay sterile because I'll need to recap this too. Okay, so my little chamber here is full, so I can now invert that again. And I got a clear line here, so that's coming all the way through. Perfect, so I can shut that cassette off, clamp that, clamp this one. This one, not to touch it because it's sterile, and we're just going to rehang this. Okay, so now that my primary tube's primed, I'll clean up my area here, and now I can get ready to insert my IV. So the patient's ready for me. She says she doesn't have any questions about it, so I'm just going to prep my station here. So I got my saline lock here. Just going to open that, not just touch it just yet. I will be making sure to label my IV tubing as well before I leave the room. Okay, so I just got my gloves here. Get those out, get it all prepped here. Tegaderm, and I made sure to lay down a chuck for my client so that if we have any blood spillage or any fluids get out, it's not a big mess. And I'm just going to prep some pieces of tape here so that they're ready for me. So I'm not fumbling, because once you get your gloves on, tape can be kind of hard to manage with gloves on. Okay, so I got a couple pieces there. I'm just going to grab this. Just going to tie it first here, just so I can locate a vein on my patient here. Find a good vein to use. Okay. So right here's a good one. I should be able to get a good stick on that. So I'll just unhook this and have the patient relax. So now I can get my gloves on. snaps, activate the ChloraPrep. We're just gonna massage the site from inner to outward for about 15 to 30 seconds. Okay, and then we'll let that air dry for about 30 seconds as well. You can toss that. Okay, so I'll just be filling out my labels here while that dries. So we got today's date, okay, 9/15, and then initial it as well. 9/15, initialing. And then for the IV site, I haven't filled that all the way out yet because I have to wait until the initial start time. Okay, so I got my tubing one at least. I can go around below the drip chamber. Boom. Okay, and then at this point I could do another pair of gloves, put a new pair of gloves on, and then get ready to insert this. Okay. Before I get that, I'm gonna make sure to, with new gloves, get this saline lock ready as well. Okay. So please just do a quick pull back to prime it, and then try not to touch these ends all that much. Just gonna open it up here, pull this, because I'm gonna need to get to this end with only one hand once I start the IV. And then here, I'm just gonna put that in and twist it. Don't need to wipe them off with alcohol because they are sterile. And then we'll just prime this line. Okay, so I got some, there's no air in the line, so I can just return that there, making sure that's close and handy for when I need it, okay? So now we are all prepared. That's fully dried now, and I'm ready to insert the patient's IV. I don't have a sharps container nearby, but that will be okay. Okay. So I'm going to get rid of this one and start with this new one. I'm gonna activate the safety. Find that vein again, there it is. So, my bevel up. Okay, I'm gonna pull the skin down and taut. And go in at about a 15, or a 10 to 30 degree angle. This is about 15. Okay, so we're gonna go in. Make sure that this catheter is able to move, and all right, we're gonna feel a slight poke here. Okay, just relax. Okay, so we're in. I got a flashback here of blood, so I'm just gonna advance it about a 1/4 inch, and then I'm gonna start withdrawing my needle and inserting the catheter at the same time. Okay, so that's in all the way. I can pull this and initiate my lock, safety lock, okay, and hold pressure here while I then disengage this and quickly put on this. Okay, and to make sure that I'm in the vein, I'm just gonna use this saline to make sure that it's patent. I'm gonna ask the patient if there's any pain, and I'm gonna observe for redness or anything like that, and make sure that there's no signs of infiltration in this IV site. Okay, patient's just responding that it's just kind of a cool sensation. They understand that that's normal. So now I'm going to, on this side, grab my tape and just place it over the hub here. Just 2 pieces. Okay. And then my Tegaderm as well. Put that there. Peel it off. I'm just gonna clean up this area and throw this into the sharp bin. So that's the sharp bin for now. And then we can just, and then now that we're in here, we're ready to finally label the IV site as well. I wrote the new time down to when it went in, so that can go on the patient. Okay. And then now we can get ready to hang our IV. Connect our IV, not hang, connect it. So we're just gonna do this so that we're able to clean both ends. So I'll start here. We'll just clean the hub for about 15 seconds as well. Okay, and hold that there. We'll grab this one. And we're gonna clean this one as well. We'll grab a new one. We'll clean that. Okay, and now that they're clean, we can connect them. Now once they're connected, we can secure the new IV line down to the patient's arm with some more tape so it doesn't get yanked out or anything. We can get rid of this. And then I can make sure that the cassette is and my pump is set to the correct rate, which is at 150 mils per hour. So I'll make sure all of this is unhooked here and open for ready to flow. And we do have a right flow, no air bubbles, and rate set at 150. So I'll make sure that the patient's tolerating it correctly, and while they're not complaining of any of the symptoms. I can clean up my area before I leave and make sure that the patient's comfortable. And I'll make sure to document once I get to the nurse's station. I'll document how the client tolerated the procedure, how the site looks, making sure that it's okay, there's no signs of infiltration, anything like that. The date, the time, and also I'll initial it as well. So, time has passed now. Make sure that everything was thrown away. And now we're ready to go back in, degloved and wash my hands. And now I'm going back in, knocking before privacy, and making sure to say hello. We're gonna come in, and the IV has finished. So we're done with that. We are ready to put in a saline lock and then discontinue the IV site. So again, we're gonna perform hand hygiene, we're gonna re-glove, and then we can get ready to disconnect all this. So we're just gonna make sure that everything is locked here. We're ready to take it apart, separate it. Okay, so we're gonna get this ready here. And pull that out. And we're just gonna disinfect it. I'm wearing gloves, I just don't have any. So I'm just gonna make sure to assess the site, make sure that it's not infiltrated, there's no redness or anything like that. And then I can go ahead, make sure that this is locked. It's locked up here. Okay. And this can stay unlocked, or we'll lock this for now. Okay. And then we'll disconnect this, get this primed and ready. Disconnect, okay. We'll just do a quick clean again, about 15 seconds. Toss that, and we'll connect these. Okay. We're gonna unlock this, and we're just gonna saline flush this to make sure that all the medication has gotten to the patient. Making sure that the stuff that's left in the line is administered as well. Okay, so I got all of that. Okay. And then once that's ready, we can then lock this and retape it down. And then that's a saline locking it. Okay, and then we'll get rid of our old tubing. Okay. Okay, and then we can get rid of the syringe here and tape it down, and we're ready. Okay, and so now it's time to discontinue. It's been some time. I made sure to chart everything that went into this patient, making sure that they tolerated all well, and we're all good there. I'm gonna come back in, I'm gonna wash my hands, introduce myself, make sure to do my 3 verifications. Shirley Coase, have her make sure to confirm her name and date of birth, make sure to check this, her wristband, make sure to check her allergies, okay, and that all checks out. And so we're gonna get ready to discontinue this, so I'm going to glove and really just explain to her that the worst part of this procedure is probably just removing the tape. So once I can get that, I lost my gauze. Okay, so I would have a piece of gauze with me. I accidentally threw it away, so we're just gonna say this is my gauze. And so we're just going to unroll the tape here. I have gloves on. Boom, boom, boom. Slowly taking the tape away while making sure that this is holding good. Okay. And we'll put the gauze over it. And we'll just remove it parallel to the arm slowly and hold pressure here for 2 to 3 minutes. If they are on anticoagulants, we'll hold it for about 5 to 10 minutes. We're going to make sure that the catheter tip is all intact and in one piece, so that there's no pieces broken off. And then we can discard that into the sharps bin. After this, we're going to make sure to assess the site one more time to make sure there's no signs of infiltration, making sure there's no redness or swelling, making sure the patient's not complaining of anything. So once that's done, we can just tape it and then have the patient take it off. Or we can stand here and apply pressure for the allotted amount of time and make sure that the bleeding and it has stopped bleeding. Once that's done, we can then make sure that our patient's comfortable. We can make sure that they're okay, they don't need anything from us, they have their call button in reach, and then we can then go to the nurse's station and chart as well. So we're going to chart the stop time, and when we took the IV out, we're going to make sure that to write down the location of it and how many attempts it took to put it in, as well as take it out. And that is it, I do believe.